In my 20 years as a physiotherapist, I've seen patients whose routine injuries hid dangerous conditions. Cancers, serious nerve compressions, systemic infections. So what saved them? The answer was recognizing these red flags early and referring them on to the relevant medical professionals. My name's Grant Frost and I'm an Australian musculoskeletal physiotherapist, and in today's video I want to talk to you about some of the common red flags that we look out for in the medical community. Not to alarm you, but to inform you so that if you feel you may be experiencing some of these yourself, you can seek appropriate medical help. Because your musculoskeletal issue, while likely to be just a musculoskeletal issue, you don't want to be the small percentage of people who may have something more sinister going on behind the scenes. And so the first red flag to consider is unrelenting night pain. And while a noticeable increase in pain at night can just be a consequence of inflammation, the more extreme versions of night pain may indicate something like a cancer. The second red flag is an obvious one, I think, and that is unexplained weight loss. Significant unexplained weight loss can be associated with cancer as well. It may also suggest a systemic illness. Red flag number 3 is a history of cancer. When we're asking a patient questions about their past history, we always want to be respectful of a past history of cancer. There's always the risk of a metastases, which is the cancer popping up in other parts of the body. So it should always be a consideration. The fourth red flag relates more to constant pain. And we're not talking about pain that feels persistent and that's with you a lot of the time. It's constant pain that doesn't leave you. It's not reduced by changing positions. It doesn't change whether you use that tissue or not. And if it's just there, regardless of what you do with yourself, it may suggest that it's not necessarily a mechanically induced pain. So again, we want to keep an eye out for cancers or infections. Red flag number 5 is fever or chills. If you have developed musculoskeletal pain, but also feel like you're getting fever and chills, this may be suggestive of an infection. And again, depending on where that might be, if it's in the bone, if it's in your blood, we want to make sure that we're looking out for these things to make sure that we're not missing something sinister. Neurologically, red flag number 6 is bowel and bladder dysfunction. If you've been dealing with lower back pain and suddenly you find it hard to go to the toilet, or you feel like you have saddle anesthesia, which is a change of sensation around where a saddle would contact your bottom, around through your buttocks, your perineum and through your inner thighs. This may be suggestive of what we call cauda equina syndrome, where the bottom of your spinal cord may be getting affected. We obviously want to avoid any direct nerve root compression that may be happening. From a vascular perspective, if you have calf pain and you feel like your calf is hot, hard, red or swollen, then we need to rule out a DVT. From an ankle perspective, if you have rolled your ankle, but there is tenderness at the base of that lateral malleoli, or there's tenderness at the base of the 5th metatarsal on the outside of your foot, and you may struggle to weight bear more than 1 or 2 steps, then we need to rule out a fracture of your ankle or foot. So while not all of these will be relevant to you, as a physiotherapist, these are just some of the questions that I would ask you just to make sure that we're not missing something that could be a little bit more sinister. Statistically, it's unlikely that you will ever experience these things, but people do. So again, we don't want you to be alarmed at all. It's just better to be aware just in case. So as mentioned, if you suspect any of these, it may then require you to have a trip to your doctor or the local hospital just to make sure that you're not dealing with any of these things unnecessarily. Because as I mentioned to my patients, it's much better to take time out of your day to explore the potential for cancer or a systemic infection and have these things dismissed rather than not do something and for them to be there under the surface. So please let me know in the comments down below, have you had this experience yourself? And if you don't mind mentioning it, what did you deal with and what happened from that? Please leave a like on the video, subscribe to the channel. If you want more of this type of content from me, please consider becoming a member of the channel. You'll get exclusive access to extra content from me, early access to videos as they drop. But it's also a great way to help support me and the channel and allow me to make these videos. So once again, thank you for watching. I hope you never have to deal with these red flags. But if you do, I hope that you can identify them early enough so that they don't become an issue. I'll talk to you soon.